Ready? I'll show my shoes. Alright, co-wipe is check your orders and check for allergies. Assess your patient. Assemble equipment such as maybe the pen light, which I don't have on right now, but I will. Let's see. W is wash your hands. I is identify yourself and the patient. You would look on their armband and ask them what their name and date of birth is. P, provide for privacy, so draw the curtain, and I would probably shut the door too. E, educate, evaluate, and explain. All right, so we're going to do the head-to-toe assessment. And I'm going to start with her skin. I'm going to look at the color first. The color is normal for the skin. The temperature is dry to the touch. It's intact. There's no lesions or bruisings on there. And let's see, the turgor, I would check right here. Turgor is good, and you can also check right here underneath the clavicle. No edema on either arm. I don't know if I've already said that. And next I would check her hair. Her hair color, I would check that. Her hair color is normal. The thickness of her hair is pretty thin. Soft hair, normal hair, okay. I would also check for inhabitants, pest inhabitants, or lesions. Okay, good on that. Let's see what's next. I would check the nails. The nails, the shape of them are normal. They're pink. No sharp edges. Everything's normal with her nails. Let's see, and then for the head, I'd be feeling for any lumps or abnormalities, and I don't feel any on her, so she's good, and that's what I would do for those three. So, all right, next we're gonna do her eyes. I'm gonna start out by looking at her eyebrows, see if there's any scaling or if there's any lesions. There's not, that's normal. Let's see, and next I'm gonna look at her eyelids and her eyelashes. Everything's intact. There's no drainage. I'm gonna look at the conjunctiva. Look for redness and swelling or lesions, drainage. That looks fine. Let's see what's next for the vision. Okay, I'm gonna hold my hand up, my finger up, and I want you to follow my finger, please. Good. Good. All right. Next, we're going to see if your pupils constrict normal with light. So I'm going to have you look at something far off. Just keep looking at it as the light shines in your eyes. Okay, good. That one's normal. Sorry. Okay, that one's normal too. Okay. Next, let's see, I'm going to do your ears, and we're going to check those out to see if they're symmetrical. If they're symmetrical, I would check for drainage or lesions. There's none on her. Let's see what else I'm forgetting. And also when I did the eyes, I would make sure they're symmetrical too, along with the eyebrows. Okay, we're on ears now. I already checked the external factors of her ear. Now we're going to do the whisper test. Have you stand up and cover your right ear first. We said 2 letters and a number. AJ2.
AJ2.
Good. Cover your other one. BH5.
BH5.
Good. Now we'll do it 2 more times on each side so we get an accurate whisper test. That's it for your ears. And next I will do her nose. Let's see. Have you breathe in. Good. I'll do this one. Sorry, I'm moving the first 2 hard on you. And next I'm going to check for tenderness. Right here. Is it tender?
No.
Okay, good. Let's see, what else would I do for your nose? I would check, and I'd probably shine my light in there, make sure there's no lesions or anything. The nares are symmetrical, nothing's wrong with those. Let's see, that's it for the nose. No discharge, nothing abnormal. Okay, next would be her mouth and throat. Her lips are dry. Okay, can I have you show me your teeth? Teeth look good. Gums look good. Next, I would look at her buccal. Everything's good. No abnormal colors. Everything's normal. Good. I would have my flashlight on because it's dark. Alright. Okay, that's good. A lot better. Alright, can I have you hold your tongue out and say, ah? I'll look at your tonsils. Good, good. Everything looks good. Normal color. Alright, can I have you look up and I'll look at the roof of your mouth? Good. Alright, nothing abnormal there. And I think that's it for that. Alright, I'm going to check the lymph nodes. So I'm going to start with the preocular. I'm going to check the postocular, the occipital, the juguleodigastric. Let's see, and then next I would do the superficial cervical, and then I would check the posterior cervical, the supraclavicle. Let's see what's next. The submandible, and let's see, I would do the deep clavicle chain. I think that's what it is, deep clavicle chain. And no abnormalities so far. Let's see, and then I would come around and I would check, make sure her neck muscles are symmetrical, and they are. Let's see what I would do. I would do the range of motion next. So I'm going to have you bring your head back. I'm going to look at her and bring it down to your chest. Alright, now bring it back up and we're going to sit ear to shoulder, ear to shoulder. And nothing hurts when you do that, right? It all goes smoothly. Yep. Okay, that all goes smooth. Let's see, and then I would check right here. I would have her swallow and check that, see if that's normal, and that is. I would feel, is there any tenderness in here?
No.
No tenderness in there. And let's see, we're going to keep going.